Hey peeps, it's Mella Ubedoble and
Elize.
and welcome. So, today's topic is titled Occupational Therapy, and basically Elize is going to outline the entire course for us. But before we get to that, please use this opportunity to subscribe to my channel. Do not forget to turn on those notifications and hit the like button for this video. Let's allow Elize to do her magic.
Okay, so I'm very excited to be here. Thank you for having me, Mella.
You're welcome.
And yeah, I can't wait to tell you a bit about my course because it's really such a wonderful course that we're doing here at UFS. And yeah, also I think a lot of people don't actually know what occupational therapy is, so they are quite uncertain when it comes to...
I'm one of them.
Yeah, what we do in the course. How do they teach us to become occupational therapists? Yeah, so just to make sure we're all on the same page, I'll start with a short summary of what OT is, and then we'll jump right into the big stuff.
Okay, great. Let's listen.
Okay.
Let's hear.
So occupational therapy. It's obviously therapy that has something to do with occupation. But what is that? And that's usually where the confusion comes in, because most people think when they hear the word occupation, it's something to do with job or work or so.
Yeah.
But in occupational therapy, we think it's so much more than that. So occupation is everything you do from day to day to occupy the time to do the normal day-to-day stuff, such as working. Work is an occupation, but so is play, feeding yourself, getting dressed, hanging out with your friends. It's all those things that add value to your life. So things that you have to do and that you need to do. And then occupational therapy is all about well-being and independence and helping people live their best life possible. And for us, this means being able to do those occupations independently. And it's
like the sound of that.
Yeah, and it's something we often take for granted. Being able to do these things by ourselves, like brushing your teeth. For example, someone who had a stroke, they suddenly have to rely on someone to do that for them.
Oh yeah.
Yes. So we actually work with such a wide variety of people, but mostly it will be people who have encountered barriers that prevent them from doing these occupations.
Sometimes we forget that it's these simple things that not everyone can do.
Yeah, you can imagine if someone...
Something as simple as just holding something.
Yeah.
You know, wow.
And if you can't do that, it significantly impacts your dignity and quality of life. So yeah, occupational therapy seeks to help them overcome those barriers, whether it's something in the environment or if it's something like the muscle strength or the ability to think clearly. Yeah, so that's basically a short summary of occupational therapy. It is such a wide variety of patients who work with old people who have dementia, or children with ADHD struggling with school, also people who are in accidents and can't go back to work, babies, psychiatric patients, the list goes on.
Wow.
Yeah.
This is interesting.
Yeah, it's really very interesting and very wide. Yeah, and now...
Okay.
Yeah, I'll tell you about the program, so how we get there finally. It's a 4-year program, and currently in South Africa it works so after the 4 years we have a ComServe or community service here, and after that we can register to practice in South Africa. Yeah.
Wow. And how long is the community service?
Just 1 year.
1 year, okay. Okay.
Yeah, so that's also fun. But let me start at the very beginning, at first year. Now, first year is basically just to introduce you to the world of occupational therapy. It's where they lay the foundations. So we have a subject, Occupational Therapy Foundations, and that's where they tell you all about occupation, the different areas of occupation there are, because we classify it, and also the different components you need for that, like muscle strength and so. And we look at how these normally develop. So it's just an introduction to occupational therapy, the philosophy, the history, just the scope and domain of this profession. And then apart from this, we also had a look at anatomy, so they teach us just
nice.
yeah, ways what to learn a bit about the human body, which is very interesting. And we did psychology.
I love anatomy.
Yeah, it was really interesting.
I really love anatomy.
I must say, it was a lot of work, but
Mm.
it's worth it. And then psychology and anthropology we did. Yes. So just to give us a foundation, a background about people in general, you know, how they work, and so yeah, so that was basically it's the most basic year. And then we get to second year.
I have a question about
Yes.
first year. Do you guys also cover like the historical aspects of
Of the profession.
the profession itself?
Yes, we have a specific topic on that. Yeah.
Okay.
And also, I forgot we have another subject which is really fun.
Yeah.
But first year is the sports and games and the arts module.
Oh, what is that about?
So we did things like playing yurkskei and wheelchair rugby, and and we made all kinds of crafts, puppets and so because
Oh wow.
because part
Did
of
you guys make them from scratch?
basically.
What do you guys use? Because when in my course, when we made marionettes in my first year, we used paper mache and
we also did that.
and wood. Oh.
Yeah, that was really fun. I must say I enjoyed that. And because occupational therapy, part of it is you use occupations and activities such as a craft activity or sports to engage your patient and help them to open new worlds for them. So that's how you help them to learn new skills. It's through using activity, using occupations
It's lovely.
to enable them to do other occupations. Yeah, and that's why they taught us how to do these things and how to think creatively and to teach us the value of these things like wheelchair rugby, which lots of our patients on wheelchairs, and just to open our world as well.
I love it. I love it. We get to see things from different perspectives and not just
Yeah.
from what we perceive.
Definitely,
you
that's
know.
definitely what happens.
Yeah. Okay, that's lovely. So
Yes.
we're moving over to second year now.
Yeah, we can move over.
Okay.
Okay, so then you get to second year, and they finally start teaching you about therapy. That's where you start to see where all the things you learned in first year fall into place. In first semester, I'm now a second year student, and in first semester they teach you to assess these things. So how do you assess someone's engagement in occupations to see where the problem lies and so because you have to look at quite a lot of things. So they teach you basically the whole first semester how to assess all the different occupations and components there are. And then you also, in second semester, they get to intervention. So how do you treat those problems that you identify? So it's really nice to finally see how all these things get applied to occupational therapy and how you can help people eventually. And you also
I like the exposure.
that's really nice because it's finally applying, it's practical. And it was really nice to do that this year. And also when we did anatomy last year, we are doing physiology this year. So
Lovely.
that's something different. And they're like anatomy was where everything is.
But it helps you because you have like this background of what is where on the
And
body.
now physiology is how it works.
Yeah.
It's really
And I also
interesting.
get to feel that because
it's incredible. It's so applicable to yourself as well.
Yeah.
So it's fascinating.
the
to look at,
muscles
really.
and the bones. and-
Yeah, it's really engaging topic and it's fascinating.
I like that.
And we also did more psychology, so we went a bit into more detail. We did psychopathology and personality.
Personality.
It's really fun. And what else? We also started with our clinical skills or clinical sciences module. So starting second year, they also teach us a bit background about various medical disciplines. So this year it was psychiatry, but then it goes on to other medical sciences that they just give us a background information that we will need to the benefit of our patients. Yeah.
Okay, but I feel like we need to mention this now. This area that we're in, it's the clinical skills building. So I want her to tell us a bit more, specifically this area where we are seated right now.
Yeah, okay, so this is a really cool place. It's really great that we have this because they use it for our training. It's the clinical skills unit. So it's where we can train and practice all our clinical skills. Especially starting this year, that's where we did a lot of assessment demonstrations and practicing techniques, and so there's a lot of space. You can't see it now, but there's a lot of space here, and we work together with our peers, and we just practice it.
I love it. And you have mentioned that there's a lot of equipment here.
Yes,
as
yes,
well.
also. So
Yeah.
we have the library or the clinical skills lab where all kinds of therapeutic equipment that you could use for patients, especially when you get placed as a student. Then there are lots of things that you can use. There are therapy balls and therapy mats and games and so yeah,
I like
kind of things you can use.
Okay, this is so interesting. I love this area.
No, it's really nice.
Okay. So, are we ready to move over to third year now?
Yeah.
Okay.
Okay, we did first year and second year, and now we get to third year.
Third year.
Yeah, so it gets a lot more practical. That's finally when they start to place you in different clinical settings. So you go to the hospital or to schools, and so you start applying what you learn on real patients, which is scary, but it's a nice growth opportunity. Yeah.
I'm sure like the first 2 weeks is like stressful.
Yeah, I hear that
I can
from the
imagine
others.
that.
Yeah.
I think generally in everything that you learn, especially if it's practical related, it's always stressful the first 2
Yes,
weeks.
until you find your feet.
Yeah.
So you have to find that. Yeah.
Oh my gosh, because it was same for me in my course as well. Like, you learn all these things and then you finally apply it, and it's just, and you have to think at the top of your head, and it's just a lot.
Yeah, it's
And
stress.
it feels like you're under pressure because you
Yeah.
don't have a lot of time to actually apply what you learn. So, yeah, I can imagine.
Yeah, but until you just get it, and then
Yeah,
it's all good.
yeah.
Yeah.
Tell us
So
more about what you do specifically.
okay, so like I mentioned, they do a lot of the clinical work. So they have to write reports. It's a big part. A lot of report writing, and then they go on with the theory as well. Occupational therapy techniques. You know, teaching more detailed aspects. So first and second year was more general and broad, and then they go more into detail. We learn how to make splints, which is for hand patients. You know, and we also learn a lot of other practical skills. And yeah, we go on with the clinical sciences that I mentioned. So different things like surgery and pediatrics and neurology. They're just an overview of these things. Yes.
That's interesting.
Yeah, and another thing that you continue with through your third year, we started with it this year, is the research project. So it's a big part of our program. Is starting second year, we work in groups on a research project, and that's like a big goal for fourth year is when you finish this project. So through third year, we work on it, and fourth year there's a big presentation day. Yeah, so it's really nice.
Wow, that's fun actually.
Yeah, no, that's fun.
Okay, so that's third year.
Yeah, that's third year.
Okay, so
If
we're
you
ready to move
summarize.
over to fourth year now.
Yeah, almost done.
Okay.
Yes, now the last year, fourth year is where they have to round off everything, you know. You get a lot of time in clinical settings. It's a lot of working along with your studies, and then of course the big research project.
Yeah.
It's a big thing to finish that off because it's really something you're committed to and put a lot of effort in. And yeah, they continue with the clinical sciences and with occupational therapy techniques. But you're just
I love it.
yeah, each year is like a different level, next
Different
level.
level.
Yeah, next level. To refine.
I don't know, but I don't know if this is the case, but is fourth year also something where you come up with your own things in a sense based on the knowledge that you've learned and you apply that as well?
Yeah, I believe you're much more independent in when you
yeah.
treat you because a lot of times there's a lot of different settings. So you can go to state hospitals or to schools and so, and there are so many patients that you'll obviously have guidance of the people who work there, but you're kind of left to do your own thing, to treat. You have to write goals for your patient and have to treat them.
Yeah.
Yes.
Okay, that's good. So that is fourth year.
Yeah.
Okay, peeps, so that was it. This was really interesting. I learned a lot about occupational therapy and I have more knowledge on it now because I knew nothing before this video, honestly. But
I'm
yeah,
happy.
thank you. Is there something you'd like to add to anyone?
Okay, I can add maybe for anyone who's ever been interested in occupational therapy, just some tips. Okay, so it's really a rewarding career. It's a rewarding field. There's it's so broad, so wide. You can go into so many different directions, like I mentioned. And yeah, if this is your dream, just work hard because it will be worth it in the end. They always say the course is quite intense, but it's worth it because they teach you how to help these people, and it's really to see this impact. It's significant. Yes, and yeah.
I feel like in a sense you also get to place yourself into someone's shoes
Definitely.
mentally,
Definitely.
because you get to see different ways in which people do
Yeah,
things.
that will you.
It's not
I
like
got into that.
yeah, especially when it comes to people who are not independent because of being paralyzed or anything like that. So
Yes.
I like this. I really like how this assists in that manner. I love it.
Yeah, no, me too.
Okay, great. So peeps, that was it for today. I hope you guys enjoyed this video. If you guys would like any information on our social media, you guys will catch it at the end of this video. And if you guys have missed any of the introduction video to this University of the Free State content, click over here to go check it out and leave a comment in the comment section, okay? But until then, I hope you guys have a good one. Toots.